I'm literally parched, whatever. Isn't it awkward how YouTube videos start sometimes? Welcome to my channel. Anyway, quick video, and I mean, I will try to make this as quick as I can. But anyway, hello, welcome to my channel. Let's get started. That's all I got. Let's get started. By the title, you can probably already tell what we're going to talk about. I had BBL surgery about a month ago, and that's kind of what you're here to see. Well, kind of. Anyway, I am making a surgery series on this channel. Because I have a lot of out-of-state friends and family that are asking me a ton of questions on my health, how I'm doing, what I'm doing, how I did it, all of that good stuff. So this will serve as a kind of documentation for them, for me, to keep updated with my process, and also for myself to kind of go back and look at everything that I went through and that has happened. Also because I want to have other procedures that I want to document as well. But ultimately, I want to do this particular video because while I was doing my own research before I had my surgery on doctors, I saw a lot of videos of other girls that were having the same procedure as me. But the things that I'm going to talk about today, I didn't see anybody talk about. So I have a few tips, and this video is going to be just mainly me talking about my experience, where I went, my doctor, you know, how that first process was for me. And also I'm going to talk to you about why I'm sitting on my thighs instead of on my BBL pillow. That's coming up. So I have about 5 different little tips that I'm going to give you that, like I said, I haven't seen anybody really talk about in any of the videos that I saw. And plus the videos that I was seeing were a little bit older. So hopefully this will help somebody that's trying to have surgery, probably like beginning of 2022, because it's December, so the year's ending. But anyway, if you're having surgery now in December, this could help you. I don't know. Anyway, let's get started. Number one question that I get asked all the time: where did I go? Who was my doctor, and how much did I pay? Now, I went to 305 plastic surgery. My doctor was Dr. William. When I was doing my own research before my procedure, because I've been wanting this BBL surgery forever, like for years. I am a mom of 2. I have 2 beautiful children, but things change, things happen, things, you know, shift a little bit and grow a little bit after you have kids. So for me, besides my mental health, which is also going to be another big topic in this channel, because mental health is a big topic for me in my own life. But besides that, I just wanted to feel good. I wanted to look good, more for myself. You know, I want to look in the mirror and be like, yeah, I do me. All of that good stuff. So before I get off track, like usual, because I have tried to film this video before and it was like forever long, so I'm gonna keep this short. 305 plastic surgery here in Miami, of course. Dr. William. I researched high and low for doctors, and based on his work, based on recommendations from other patients of his, friends of mine, I decided to go with him. That was basically it. So also the clinic hasn't had any deaths that I know of, which is a big thing here in Miami. I have heard horror stories on girls that have had very heavy, bad complications because of places they go to have their surgery. Anyway, the contact process with them was pretty simple. I contacted them through Instagram, and like a day later, I got a call back from a young lady who kind of walked me through how the process was gonna go. I did a virtual consultation, which is where I send them a bunch of pictures that I took myself on my phone, and she came back to me with my quote. Now, at the time, they were having, and this was at the beginning of October, like second week of October, I think it was. So at that time, they were having a promotion, which when you book your surgery for a date in October, they gave you $500 off your surgery plus $1,000 in credit towards things that you need, which included 2 fajas, which is one of the tips that I'm going to give you later on, the BBL pillow, 2 foams, and the ab board. So I took advantage of that. I was like, yeah, you know, I want to have my surgery. I know that I'm going to have it, so might as well take advantage of the discount and what I'm going to get that I'm going to need regardless for my recovery. So, like I said, I sent them my pictures. She came back to me with a quote. I told her, yes, we're going to go ahead and do it. She sent me an invoice through email. On that invoice, there was a link that I clicked to put my deposit in with them. Now, tip number 1, and like I said, this is just my personal experience, things that worked for me, things that I did, and what I think would help some of you that are hopefully looking for surgery content. If that's even a thing, help and information. My suggestion, and I have heard other girls say this exact thing, don't pay for surgery up front. The way I did it, and I know a lot of people, like I said, do the same thing, you put in your deposit, pay for surgery on the day of your pre-op or the day of your surgery, whichever comes first, and I'll tell you why later, because my pre-op and my surgery date happened at the exact same time. And the way I see it is it's easier if something changes, if your labs are come back abnormal. That was the word I couldn't think of. Comes back abnormal, like it happened to me. If you change your mind, if something happens that you cannot have your surgery on the day that you're scheduled, it is a lot easier to get your deposit back than it would be to get the full amount. In my case, the full amount of that was $7,000. I gave $500 as a deposit, and then at my surgery date, I paid the rest, $6,500. So it would be easier for me to kind of fight them, worst case scenario, fight them for $500 versus the whole $7,000. So take that information, do with that what you will. So I gave my deposit of $500. She sent me back an updated invoice saying that I had $6,500 to pay. And they give you different options. I paid in full for mine, but if you're going to finance, that's a whole different process. They do have a few finance options, and you can discuss that with your coordinator. If you happen to go to 305 plastic surgery, you can discuss that with whoever you work with at that time. So she also sent me the contract via email. Everything was done through email up to that point. After I gave my deposit, a few days later, she came back with a surgery date of the 29th of October. Now, going on to labs. Leaving my first impression of them behind and moving on, the last thing I want to say about that is everything was so smooth. From the first contact through my, doing my deposit, everything, she answered all my questions. She, everything was very, very smooth. Now, they will send you and I'm sorry I'm looking down, but I have like a list of things that I want to talk about and mention here. So among the things that they send you, they will send you a clearance form that your primary care doctor has to sign off on. They will send you a lab form. And here's tip number 2. When you get that form, and something that I didn't know about was that you can take that form and go to a lab. I thought that I had to have my primary care doctor send something to the lab before I can get my labs done. I didn't know that I could take that form that 305 sent me and go on my own to the lab and do the lab work that I needed to do. So tip number 2, you can definitely take that form. You don't have to wait for your primary care doctor, and I suggest that you don't wait because 305 plastic surgery, states on their form that they give you or what have you when you contact them that they need your labs 10 days prior to your surgery. So for me, since I was doing it on the same month, I was really, really pressed for time. So I wish I would have known that I could have taken that lab form on my own to LabQuest to do the labs on my own time. I would have been there the next day and that would have been done, but I didn't know that. So my process with the labs was a little bit delayed because I had to go to my primary care doctor. When I went in to do my labs, he didn't put in the right labs that I needed for surgery, so they couldn't do the labs at the clinic. And one of the ladies actually at my PCP's office told me that I could take that form and go on my own to do my labs. So I did that. Thank God that everything worked out and that I was able to do my labs. They took my insurance. I didn't need anything else. Tip number 3 with that, I will tell you that if you do go on your own to do your labs, please ask them to fax a form to your doctor's office. Why? Because your doctor will need to see those labs before they can clear you for surgery. So yeah, besides faxing them to the 305 clinic or whatever clinic you are going to do your surgery with, they also should fax a copy to your doctor's office. That way your doctor has it. That way they can check them over before they give you the clearance. So I do my labs. I go a few days later, I go back to my doctor. My Dr. William wanted an EKG. Besides the other lab work, blood work that he wanted done, he wanted an EKG. Tip number 3, 4, whatever number we're on. Plan for the worst. Why am I saying that? Because my EKG came back abnormal. My doctor, after I ran around like a chicken with my head cut off trying to get my labs done, calling them because I didn't know for the lab place, I didn't know that they had to fax a copy to my PCP. So I had to call them. I had to wait like an hour on hold for somebody on the phone so they can fax it to the clinic. It was a whole big issue. And like I said, I was pressed for time because my surgery I only had 3 weeks to do this. So, and it's not a long time. You say 3 weeks, but 3 weeks isn't a long time when you're running from appointment to appointment. So, other tip, plan ahead. or schedule everything right away. Don't wait, because what can go wrong will go wrong. My EKG came back abnormal. My PCP will not, she had me do an extra chest x-ray that Dr. William didn't need, just for her to give me my clearance form or fill it out. So plan ahead. I had to rush to get an appointment with the cardiologist because she wouldn't clear me for surgery, which in hindsight I appreciate, because first and foremost I want to make sure that I'm healthy and that I can, you know, stand the surgery, which now I appreciate. Back then I was like, you know, this girl is ruining my life because I'm not going to be able to have surgery on the day that I want because she won't give me the clear, whatever. But plan for it. So I went to the cardiologist. He did the EKG. He did the examination. The EKG came back abnormal again, but because of my age, because of no prior history, no symptoms of anything, no nothing, he told me I was fine. I wasn't at risk of anything. Everything was good. So, you know, just be mindful of the time you have and know that stuff can go wrong at any time. Now, a week before my surgery date, I got a call from the clinic, from 305. I got a call from them asking if I wanted to move my surgery up to the 27th. At that time, thankfully, they had all my labs, they had everything that they needed, everything was fine. So I told them yes. They told me that I could do my pre-op and my surgery on the same day. So I went in on the 27th. I did my pre-op. At that time, I spoke to Dr. Williams' assistant. She explained to me kind of the realistic expectation of the surgery, what was gonna happen, all of that good stuff. I paid my remaining balance. They gave me a prescription for antibiotics, a prescription for pain medication, you know, everything that I needed for that time. They will not give you the stuff that you need, like your extra faja, your BBL pillow, and all of that stuff until your pre-op, not pre-op, I'm sorry, post-op, which is the following day after your surgery, which is another tip, like a couple more tips that I have for you. So I had my surgery, everything. So I was filming and then my camera died. Fun times. Back to what I was saying. So I had my surgery, everything went great. Yeah, totally lost my train of thought. I had to put my camera into charge and then, but one thing I wanted to mention, which, oh yeah, I remember. So after you have your surgery, whatever clinic you decide to go to, most of the clinics will give you a faja that you will go home in after your surgery. And then they'll give you, if you purchase like a package from them, like I did when with 305, that they had that promotion where you got a few extra things with your surgery. If your clinic does that, my recommendation to you is during your post-op visit, which would be the next day, when you get your stuff, and like I said, this is my experience, so I'm talking from what I know with 305 plastic surgery. They will give you the rest of your package or the rest of your stuff, like your second faja, your ab board, your foams, everything like that. They will give you in a little goodie bag the following day after your surgery when you go for your post-op. my recommendation to you is when you go get that second faja, ask them for a size or two smaller. When I came out of surgery, I was in a 5XL. Within 2 days, I was down to a 3XL. And from then, I went down, right now I'm at a small, and I'm only 1 month post-op. And I've had to go like 2 or 3 times to the seamstress to take in my faja, because I purchased a third faja like 2 days after when I went in for my massages. I purchased a third faja in a 3XL, which is what they're... Oh, by the way, with the package that I purchased, I also got 3 lymphatic massages for after my surgery. So, which those were fun. But yeah, my recommendation is for you to ask them for a couple sizes smaller, because you will start to shrink rapidly. I did anyway. But I was drinking a ton of water. I was taking my lymphatic draining drops or whatever, which I'm gonna do another video as part of this series. And if you guys want to see anything on there, if you guys have any questions, you can always leave a comment in the comment section, and I will, you know, talk about it or let you know like my opinion on certain things. But I will make another video soon about the things you really need for surgery. There was a lot of stuff that I bought that I did not need. Like the peeing thing for the toilet, whatever. There was a lot of stuff. So probably there's a lot of stuff that, okay, I'm not gonna say that I didn't need. There was a lot of stuff that I didn't need. There was a lot of stuff that I should have waited to buy. And there was a lot of stuff that I didn't buy that I should have bought. One of the things that I suggest not wasting a whole lot of money on is a BBL pillow. Why? Because like for me, I'm only 5'2", so my BBL pillow that I got from them was really tall. So when I would sit on it, my feet wouldn't hit the floor. So like I said, I got that as part of my package, you know, so I used it for a couple days and stuff. But if I would have had to buy it, I wouldn't have wasted my money on it, because there's other alternatives. And like I said, I'll make a second video about that, and I'll talk about what else I used my alternative to the BBL pillow, and I'll go into a little more detail as to why I don't think it's very helpful. Also, I have a few other things to say about the faja, but that'll be in another video as well. But anyway, I hope that this video was helpful for whoever is, you know, wanting to do their surgery in 2022. If you are looking for a specific doctor, do your own research. But I strongly recommend Dr. William and 305 Plastic Surgery. I've seen all of their doctors work, and they're all great. I was looking for a specific look, which is why I went with him. But like I said, do your own research, and yeah, that's really all I have to say on that. I hope that this video is helpful, and I will catch you on the next one. Bye.